Hi, my name is Tom Jennings. I'm a practicing physician and president of MedicalNet Systems. Thank you for giving me the opportunity today to share some of our thoughts with you. In this video, I would like to discuss how EncounterSuite's point-of-care wellness and disease management guidelines and patient registries work. The Wellness and Disease Management Guidelines are based on Michigan Quality Improvement Consortium, or MQIC. There are three types of wellness guidelines: adult vaccination, childhood vaccination, and general age-related preventive testing. Studies have shown that physician compliance with patients is generally low. While seeing patients, it's difficult for a physician to remember what to do, to whom, and when it is needed. Studies have also shown that point-of-care reminders increase guideline compliance. In EncounterSuite, there is point-of-care guideline reminders. The guideline wizard icon turns yellow when there are unmet guidelines. There are three numbers in this dashboard. The first two numbers indicate the unmet wellness and disease management guidelines. The third number indicates the number of clinical trials the patient is eligible for. Clicking the icon calls up the Guideline Wizard pop-up window. Unmet guidelines are in yellow. The physician can take 4 actions on a guideline: place an order now, place an order in the future, indicate that the guideline has already been met, or indicate that the guideline should not be applied to this patient. We will discuss 2 of these actions. Clicking the Order Now link places an order into the assessment and plan and an indication that that order has been made in the guideline. Note that the guideline is still yellow because the guideline is still not met. Once a guideline has been met, it is no longer yellow. The physician can document that the patient cannot meet a guideline for a particular reason by clicking the Not Applicable link. Once the Not Applicable reason has been submitted, the guideline is no longer yellow, and the comment indicating the reason is embedded into the guideline. Disease management guidelines work the same way. This is a list of the current disease management guidelines. Disease management medication guidelines ensure that the patient with certain medical conditions is taking the recommended medications. This is the list of the current disease management medication guidelines. All guideline types, wellness, disease management, and disease management medication guidelines, can be edited, created, and inactivated. Patient registries are the aggregation of all the guidelines for all the patients in the practice. The registries are divided into wellness and disease registries. The wellness registries contain all the patients with appropriate demographics who are due for preventive medicine tests or procedures. The disease registries contain all the patients in the practice with a given disease. They are listed with the appropriate disease management and disease management medication guidelines. The disease registries cover the same 5 diseases as the disease management guidelines. Unmet guidelines in the registries work the same way as point-of-care guidelines. Registries are a means for physician organizations to conduct chart audits remotely. EncounterSuite's patient registries are generally fairer and more sophisticated for 2 reasons. First, order status is documented so patient noncompliance is identified. Second, patients deemed not applicable by a physician for a certain guideline are identified. There are demo videos for the Guideline Wizard and the patient registries at our website, www.medicalnetsystems.com. Thank you.